Immunization coverage in Kenya has been stable over recent years at approximately 80%, but below the national target of 90%. Some few areas in Kenya, however, have seen low immunization coverage. Kibra and Langata sub-counties are some of those areas. Inequity in access to immunization services is a great contributor to performance gaps. A knowledge, attitudes and practices study conducted in low-performing counties in 2017 and 2018 found there is inadequate knowledge among caregivers about the benefits of vaccines and the need to complete the immunization schedule, as well as an inability among healthcare workers to explain key messages to create confidence in vaccines and the vaccination program.
Mimi ni housewife. Niko na watoto wanne. Mtoto wangu wa kwanza ilikuwa na changamoto kwa sababu sina saa kila wakati kwenda hospitali. Mtoto amegonjeka. So, huyu nimepata rahisi kwa sababu sijafunga kazi zangu niende kwa kituo cha afya. Wamekuja direct mpaka kwa mlango na wamehudumia mtoto vizuri. Nilikuwa na laana potovu juu nilikuwa nimesha lose hope kwa sababu nishachelewa kwenda kwa kituo cha afya. Daktari wataniletea shida. So nikaogopa, nikasema waache liwe liwalo, mimi sitampeleka.
Nilipata kazi. Maisha hapa nilikuwa ninaona imekuwa ngumu, nikasikia tukienda huko nje tutapata pesa mzuri. Hapo nikaamua pia kwenda. Nilikuwa na mtoto mdogo. Nikaachia mamangu. Nimerudi nimepata mtoto apelekwe hata clinic. Niliachia ndio hapo. Mtoto amekuwa mgonjwa.
Nairobi City County, in partnership with the national government and Save the Children, and with funding from Pfizer Foundation, is bridging the gap by bringing immunization services closer to the people.
We had only one sub-county depot that was serving a whole 70 facilities, that was in Langata. So when the project started, we started Kibra sub-county depot. Here at the depot, I served 34 facilities, but we had a problem with storage capacity. So courtesy of Pfizer project through Save the Children, we were able to get 18 fridges, 5 freezers, and 80 vaccine carriers. So a mother is able to get the vaccine within her reach.
The immunization project had 3 key objectives. The first one was to improve the uptake of immunization services in the project sites. The second one was to support Ministry of Health staff at national, county and sub-county levels by improving their capacity to be able to deliver immunization-related health services. And the last objective was to increase social acceptance of immunization services, majorly by tackling the social barriers to the uptake of the immunization.
One of the approaches being used in the Pfizer Foundation project that was born in 2020 is through community health workers. In Kibra, Nairobi, it is now common for health workers to move from door to door, sensitizing families on the need to have their children vaccinated.
Save the Children imetuweza kutupea elimu. Imetusomesha sisi kama CHV, tukajua kazi yetu zaidi, tukajua mchanjo from BCG mpaka measles huko. Tunashughulika na hawa watoto under 5s, tunashughulika na wamama wajawazito. Tunafanya referrals kwa tukipata tatizo kwa kijiji. Pia tunashughulika na magonjwa yote ama defaulters pia tukipata kwa kijiji tuna refer kwa hospitali.
Mtu kama Grace, kama mimi amenisaidia sana. Ningepuuza tu na mtoto akae tu hivyo. Sasa tumesaidika, nimeelezewa venye naweza endelea na kumleta clinic. Amedungwa hii sindano ya measles. Sasa nimepangwa vizuri venye nikikuja after 1 month watakuwa wananisaidia.
Majority of people have a lot of stories to tell one another in the community in regards to vaccines, causing impotence, causing infertility, giving paralysis. All these things are myth and misconception that needed somebody to actually tell them what exactly is happening. So you find our interaction with the CHV, training them, sensitize them, engaging with the community, going all the way to door and talk to them. It's able to actually clear this myth and misconception from the parent and allow that parent to comfortably allow you to actually give the vaccine to their child.
Hiyo myths and misconception ilikuwa mbeleni, ambapo watu walikuwa na believe kwamba dini yao inawakataza kupeleka mtoto kliniki. Ulikuwa train tukawa tunapeana health talk kwa kijiji. Watu wakarudia wakajua kwamba mambo ya chanjo inawasaidia.
Tunaona tulichelewa hii kidogo.
Vile mhudumu wa afya alikuja alinielezea umuhimu wa chanjo. One, ina prevent mtoto kwa magonjwa ndogo ndogo. Two, ina keep mtoto kuwa healthy. Three, ina make mtoto kuwa strong. So kuleta chanjo kwa mlango, kitu ya kwanza imenisifia time. Imenirahisishia mtoto amepata chanjo. Alafu imeni keep busy na isaenda job na I can do anything.
Wakati CHV walikuja, walituongelesha tuweke watoto wetu wawe kwa lishe bora, na tena watoto waende chanjo kwa sababu chanjo ni kinga muhimu kwa maisha ya mtoto. Tukikosa kupeleka watoto kwenye chanjo inaweza leta shida kwa mtoto, hata tumpoteze.
Any child that has gotten vaccination is at least being saved from morbidity and mortality. So of course that will improve the outcome of that child.
Our theory of a change ensures that we deliver these services closer to the children where they are, for them to be able to access these services without a burden and without any cost.
Reaching all children with immunization is important for their current and future health and is part of the Global Immunization Agenda 2030. The agenda highlights coverage and equity as a strategic priority goal to reach high equitable immunization coverage.
Since the onset of this project, we've been able to reach approximately 3,000 children with our door-to-door strategy. So these are children who ideally would have been missed out if we did not have such a project.
Welcome. We have new updates, we have new vaccines in place. So through Save the Children Pfizer project, we were able to conduct an operational training on microplan. So through this microplan, they're able to identify their challenges, they're able to plan early.
We were able to do something we call outreaches, and some of them we do door to door, ensuring that all kids are vaccinated.
We were taught about management of vaccines, taking care of the fridge and how to reach out, which was done to the healthcare workers and the community at the same time, because we work hand in hand with the community. Another thing is we were introduced to mentorship.
Since the launch of the project, there has been notable increase in immunization coverage and social acceptance in Kibra and Langata sub-counties. However, even with the good progress registered so far, there is much work to be done if Kenya is to meet her Global Immunization Agenda 2030.
We'll continue advocating within the ministry to allocate more funding for this important health coverage delivery aspect in terms of immunization, to ensure that no child below 5 years dies of any preventable diseases, and they continue to be protected, and of course learn throughout the achieve quality education for them to be able to achieve their potentials in the future.
Leo anapata tu shindano ngapi? 2 mguuni.
If the support that we've received here can be given to many other facilities, we are sure that the uptake of childhood immunization, of course, will go up, because we've really seen the impact that they have made in our communities. And I'm sure even if you were to talk to our communities, if they know, if they know who has brought all this, they would be just say, save the children to continue.
Ningependa kuelezea wamama wenzangu wenye watoto wao wakupata chanjo zote, wapeleke watoto hospitali na watatibiwa bado.